Minister, overcrowding throughout the state is out of control. It is in part out of control because of the increasing wave of the Omicron variant, but it's significantly out of control due to the fact that there isn't enough resources in the state. This is not new that we have overcrowding. It's been overcrowding for the last 15 years. Now, last September, you announced that you wanted to gut hospital capacity even further by closing the A&E in Navan Hospital. Will you drop this plan?
Thank you. Minister.
Thank you very much, Deputy. I'll answer your question specific to Navan in a second, but I must just address the statement you've made. It is simply manifestly and verifiably false to say that we are gutting hospital capacity. And I think if you were being honest, you would know, Deputy, that that is a preposterous and verifiably false statement. The reality, Deputy, please, I didn't interrupt you. Deputy, with the greatest of respect, the record will show, whilst of course there's a huge amount more to be done, that over the last 2 years, more beds have been added to the hospital system than any year on record, and more clinicians have been added to the hospital system than any year on record, and more diagnostics have been added to the health system than any year on record. They are verifiable facts. So it is just unhelpful for you to make statements that this government, or indeed any government, is gutting the hospital system. Now, I want to speak directly to the very important point you raise on Navan. I'm acutely aware that any considerations of changes to health services can cause very legitimate and very real worry for the populations who are served by those hospitals and indeed for the workforce that are involved. Any consideration of changes must ensure that we have patient safety and high quality services right at the heart of them, that patients can access the best possible services when they need them, including when they are critically ill and when they find that they have to go to a minor injury unit or an emergency department. The HSE, including the most senior clinicians in the area, their view is that the changes to services in Navan are needed for one reason: to support the safe delivery of care on a sustainable basis. And this is in line with the small hospital framework. So that's not my opinion. That is the view of the senior clinicians charged with keeping people safe. And now, as the Deputy will be aware, I instructed the HSE to pause in the planning of these changes in order to commence an engagement process with the Deputy, with other elected representatives and with the community. And my understanding, Deputy, is that we'll be having that session very shortly.
Minister, anybody can give a year or two and claim increases in those year or two. 20 years ago, there was 22,000 hospital beds in this state. Today, there's 14,000. Do the maths, Minister. 10 years ago, it was stated that there was needed 500 ICU beds in this state. Today, there's 300. We have one of the lowest rates in the OECD. You can't hide and talk around that issue. Now, one of the reasons the government is saying that they're looking to close the A&E in Navan is because they say that there's a threat of adverse incidents. Well, I contacted the National Incident Management System. It showed that in 5 years, there has been an increase from 79,000 adverse incidents in the hospital system to 105,000. There has been a 37% increase. I asked them to tell me which hospitals were suffering most. They wouldn't tell me. They said they didn't want to create a league table of hospitals. They did tell me, though, which hospital groups are suffering most from adverse incidents. Now, the RCSI had a 74% increase in adverse incidents in that timescale. You're looking to close a hospital, A&E, in the Ireland East group and push them towards the RCSI group. How is that safe?
We're over time. Yeah, Minister.
Thank you very much, Deputy. As I said, and as the Deputy will be aware, I personally intervened to stop the process that had gone on. My view is that any consideration like this must involve the local communities, it must involve the healthcare professionals, and it must involve those elected by the local communities to represent their interests. And I'd like to acknowledge that the Deputy, as well as other elected representatives for the area, have submitted very detailed questions. The HSE has pored over those, provided very detailed responses. And what I want to do now is I want to sit down with the Deputy, with all of the other elected representatives, with the senior clinicians in the area to go through all of these very legitimate questions. Questions like, has there been sufficient investment in Navan? Are the bypass protocols that are in place working? has there been sufficient investment in the other hospitals where people may go? When we are told that there will be more clinical activity in Navan, what exactly is it that is being proposed?
Margaret, there's been 105,000 adverse incidents in the hospital system last year. 105,000. That means people who are misdiagnosed, mistreated, given the wrong medication. It means people dying. It means people being disabled by those actions. It means people extra sick because of the misactions of the HSE. Now, I would ask, which one of your extremely well-paid staff is actually responsible for this increase? Is there any accountability? I speak to senior clinicians in the RCSI. They tell me that if you close Navan A&E, it will increase the number of adverse incidents in the RCI hospital groups. The excuse for adverse incidents being a reason to close the A&E in Navan Hospital is absolutely wrong. And what I would ask you, Minister, to do is make a decision and say we are not going to gut hospital capacity during this time of crisis. We're going to maintain the A&E in Navan Hospital, and we're going to invest to make it safer.
Minister to conclude.
Thank you, Deputy. The question that you and I have to answer as elected representatives is this. If we are being told, on the record, not in private conversations where maybe we can or cannot quote directly and name individuals, but if you and I, and all of us here, if we're being told by the senior doctors that we need to do X, Y, and Z, okay, but if we are being told in open session by named individuals who we can hold to account, who are providing us with information, if we're being told that changes need to be made to the healthcare system, whatever they may be, investment in the National Ambulance Service, investment in mental health services, investment in minor injury units, investment in more care, if we're told that these are the changes needed to protect the lives of the people we represent, then what do we do, right? So what I am proposing that we all do, because this is a really important issue for Navan Hospital and for the communities, that we all get together with doctors who we can ask questions to directly, who have to put their own names and reputations out there and say, this is the advice we get. We need to listen carefully to them, and then we all as elected representatives need to have a conversation to say what is the best thing to do for the people of Navan.
Thank you. No, we're way over time. Thank you.